All right. Hello, everyone. Welcome to our Healthy webinar for this month. I am Beth Edwards, and I'm going to be introducing you very swiftly and passing over to Ros and Virginia. Before we start, a few housekeeping points. So throughout the session today, if you have any queries or questions or comments, you can write them in the chat, and there'll be somebody there watching the chat. At the end of the session, we'll have time for questions for Ros and Virginia. So if you have any questions, if you write them in the Q&A button on Zoom, then we'll be able to put these to Ros. And finally, the session is being recorded, and there'll be a link that's sent out to you that you'll be able to watch back for about 5 days, and after that the link will go onto the Healthy site under the members area for you to watch back again. All right, so we're really excited to have Ros with us, and Ros does a multitude of things, and today what she's going to be talking with Virginia about is communication skills in the veterinary sector. So I'm going to pass over to Ros and Virginia.
Right. Well, me first. Hello, everyone. Welcome to you all. We're coming from opposite ends of the world. So Ros is in the UK, and I am in Australia at the moment. So yes, even though we're chatting as if we're in the same room, we're actually not. So let me start by asking Ros about what she's been doing in the area of English for vets, veterinary medicine.
Yeah, well, I was really, really pleased to be asked to write some materials for this particular area, or rather, I agreed to write some materials and volunteered to do that. It's an area that I just find really, really fascinating, and the more I read about it, the more fascinating it becomes, I think. I'd attended a couple of conferences last year, and that sort of really spurred me on to look into this aspect in a bit more detail. One of the things that came out of one of the conferences was a piece of advice that had been given to veterinary students, and the advice was speak to the clients, i.e. the owners of the dog, the pet, cat or whatever, as if they're intelligent 10-year-olds. And I thought, even if I spoke to my nephew, who's a very intelligent 10-year-old, I think you might find it a little bit patronizing. So I thought, well, let's have a look a little bit more into this. And I found, to my delight, and I'm sure those people that already train doctors and nurses, that there is a version of the Calgary-Cambridge Guide that has been adapted for vets. So all of those sorts of clinical communications criteria, which we'll talk about a little bit later on, has been adapted for the veterinary practice. So I thought that was interesting. I then went about sort of looking at this in more detail, looking at some of the research, and I've also had the chance to sort of interview a couple of people working in the field. And I'll talk about those people later because they're trainers like us, but they're working in slightly different fields, and the sort of maybe less appealing. One of them maybe less appealing, but we'll look at that later on. So yeah, I mean that's and I came across a fabulous webinar the other day, led by Jonathan McFarland, looking at humanities in medical humanities, but related to veterinary practice. And that was absolutely fascinating webinar. Yeah. So it's been I'm starting my journey.
A wide range of experience so far. Well, the first thing you're going to look at is the similarities between veterinary medicine and human medicine. So did you want to just get everyone to jot down a few ideas in the comment box? What do you think the similarities are?
Yeah. If people have, just write in the chat what they think the similarities might be. Or if you already work in the area, then, Alex is saying empathy. Yep, absolutely. Open questions. Yep, absolutely. What else have we got? caring for the people around as well as the patient. Yes. I'm not sure who wrote that, but that is very, very key. Yeah. Very, very key. All right. Jan, thank you for that. Yeah, that's really key.
Yep.
All right. So, yeah, I mean, in terms of clinical communication, we'll look at those in a little bit in a moment. But yeah, I mean, there are lots of differences, but there are also a lot of similarities. And I think that will sort of, if you're new to this area, but used to teaching other healthcare professionals, then, you will be a little bit reassured in that sense, I think. So obviously similarities, dogs have coughs. My mum's dog had a kennel cough the other day, and he was banned from the local kennel. So I'm looking after him next week when they go on holiday. Exactly. They have coughs, they have allergies, they have toothache, they have all sorts of sort of conditions that we also as humans have. Sadly, they also have diabetes, they also have cancer. So in terms of the medical conditions, there are a lot of medical conditions that we are also familiar with. Working in human medicine, and also things like the stresses of vets working in the practice that they work in, even with small in small animal practice, where I've done some, I've been doing some observation work. And this was reiterated in this webinar that I attended the other day. A lot of the people in the webinar were based in other parts of Europe. So apparently in Europe, there is generally a shortage of vets, particularly in small animal practice. And so, we can compare that with, the shortage of nurses, the shortage of doctors in Australia, in the UK. It's, there are lots of similarities, I think. Yeah.
Well, many of you will be aware that one of the professions that's tested in the occupational English test, the OET, is veterinary medicine, and the occupational English test has a speaking subtest with 2 role plays, and so the vets will do two role plays, just as other professions do. And the role plays are marked against the very specific communication criteria. So Ros, what do you think these communication criteria of the OET, are they useful for the English for Vets classroom?
They are very useful, and I think Gian's already pointed that out, and Alexia, in terms of the empathy and the open questions. I do have there is a bit of a caveat, I think. I don't know if that's quite the right word, there, but we'll come to that in a while. But a nice little quote from Suzanne Kurtz, who's a contemporary of Jonathan Silverman, who devised the Calgary-Cambridge Guide. And this is something that people will recognize immediately. So the practice of excellent veterinary medicine is inextricably linked with skilled communication. You cannot have one without the other. So I think that sort of says it in a nutshell, really. But, if we look at the different criteria of OET, and we can see there's an awful lot of mileage out of what we already know and already do with human medicine. So rapport building is key, as I think people have highlighted already. I think,
and that's for the animal as well, isn't it? That's it's not only the owner, it's the animal as well, building a rapport with the animal.
Oh, absolutely. Yeah. I mean, obviously there's the open question, how are we getting on? It's how are we, as opposed to how are you, because obviously there's 3 people minimum, there could be added children as well in the consultation, but there are 3 elements to this. It's a sort of a triad. So the pet, the vet, and the client. And so but I think understanding the role of small animals. So I did, I don't know if I mentioned earlier, but I did some observation work in the local veterinary practice near my house, and And so the the understanding of the role of the pets, of small animals, is really, really essential to understand before you look into to all the rest of it. So there was this lovely example of a little rescue dog called Scott. A little rescue dog. He was a Scottie. I can't remember his name, but this little dog, tiny little thing, had no eyes, so he was blind. He was deaf.
Oh.
He was 17 years old, and they bought him from a rescue centre. And
Yes.
the wife, who wasn't present in the consultation, is in a wheelchair. And so this little animal sits on her lap, and it's really, so the guy was saying, well, who would buy, who would take on a rescue dog who's already 13 years old? When they bought him, he was 13. He's blind and he's deaf. But but actually this little creature was like the center of their world, so it was, but I mean, it's also played out in the sorts of products that you can buy for dogs in particular, but also cats, all the toys is just, but, puppy shampoo. Well, why is puppy shampoo going to be any different from, adult dog shampoo? Or, we're also a lot more animal friendly than we used to be, I think, certainly in Europe. That's something that's that's also evident. But so looking more closely at rapport building, empathy and reassurance, you've got to be able to empathize, as you say, with the animal and reassure the animal. Obviously, that can be done with the voice as well as touch, etc. And the client, because obviously that is very key. There may be children in there in the discussion as well, so you've got to bring them into the conversation. And other things like consent to examine the pet. Is it okay if I just check just check the dog over, carrying out a procedure? What I would suggest, if you're happy, this is sort of I've directly quoted, I'd like to look at this in more detail and take some fluids. It's this is even that the other interesting thing which I've found quite key is also being non-judgmental. What the client wants to know is that the vet understands that whatever decision they have made about the care of the pet is that it was done in the pet's best interest. That's what they believed was the pet's best interest. So other aspects, information gathering, the use of open questions, but what I found, we talk about the cone technique, open questions going to close questions, because you've got to get the client to interpret the dog and how the dog's feeling. There's a lot more closed questions, more closed questions, because you can only sort of get a general under. Do you know what I mean? It's sort of they've got to try and pinpoint quickly, because obviously there's a time element as well. You've only got 10-15 minutes for your consultation, whatever, but there's a lot more closed questions. But what is interesting is that you found that talking about sort of embarrassing issues or sensitive issues for most clients is much easier than asking a patient. So, going to the toilet regularly, pooing and weeing normally, you wouldn't say that to a patient. But for most clients, although I think not all of them, so you'd still be useful to sort of use those sort of front facing, what do we call them, front loading expressions. Can I ask about how's it going with the toileting, or is it okay if I just ask, so for most clients, I think, talking about pooing and weeing and firm feces and whatever it seems to be okay. They'll even take pictures and produce them for the vet,
brilliant.
Which
yes,
I kind of like, ooh, okay. But these are all things that we're familiar with, and then eliciting, incorporating the patient's perspective, the client's perspective, sorry, is you have to do that as well. You've got to get the client on board. Otherwise, how is the treatment, how are they going to adhere to the treatment? Because, it's not the dog who's going to adhere to the treatment. It's the client making sure
building
that
trust and all that sort of stuff. Yeah. Yeah.
All of that stuff. Absolutely. Yeah. Information giving. They use analogies with human conditions and human medicine, which is interesting. So I don't know, like toothache or, tooth care for puppies is really, really key at the beginning when as a new puppy. And so, well, you wouldn't let your 3-year-old, not brush his teeth, that's sort of, it's a little bit kind of shaming, blaming and shaming, but
also sometimes the like you mentioned diseases that both humans and animals have. Sometimes although they're similar, there are slight differences because of differences in anatomy and the way they process things. So
I know, definitely, yeah.
And also, as you and I have talked about this before, about giving information about medication. It's very similar, isn't it? You're still talking about side effects. You're talking about how often to give it, what the dose is, that sort of thing.
Yeah.
So very similar.
No, yeah, absolutely. But what I didn't notice was them sort of doing a teach back at the end, just to check that the client has fully understood about the dosage and the frequency, and that could have been, incorporated, I think. But the observations that I just for people, so people understand, the observations that I carried out were with native speaker vets. So, I think they were lacking in that, they had a lot of empathy, a lot of reassurance, all of that sort of stuff. But when it came to, sort of chunking and checking, that could have been improved, I think. But, otherwise, that, we'll come to later the different, why I think that the OET speaking clinical criteria are not entirely fit for purpose. But in the main, I would say, feel reassured. If you're interested in going into this area, then lots of similarities.
You've got the structure. Yeah.
Yeah.
So that's a whole lot about the similarities. Now let's move on to the differences. So what do you think?
Well, the initial one is the smell. I was in often standing in a cubicle, literally a cubicle, not much, sort of 6 foot by 6 foot, and well, a little bit bigger than that, but anyway. And you're in close contact, and there's a lot of sort of going on after people have left. So the smell. That was a bit of a difference. The smell. But I guess depending on which area of healthcare you're in, the smell might be a similarity. I don't know. But anyway, no, I mean, I think obviously, as you've already suggested, that there are obviously differences in terms of anatomy and differences in terms of diseases and conditions. But there are regular things that seem to come up quite often. It's generally somebody comes in and says, oh, I found a lump. I found a lump on the neck. I found a lump on the back, a lump on his leg. Can you take a look? It's very often a lump, or a bite or something like that. But, there are things like, there's this fly strike which can affect rabbits, for example, and so that's sort of basically sort of a fly will lay its insects in the fur of the rabbit, and then they hatch and they're maggots. And then, I don't want to go into any more details, but people can look it up if they want to. And it can be, but it can be fatal. It can be fatal because the rabbit can get like a sort of a toxic shock. And so it can be fatal. So there's things like that. And obviously, if people in the audience are pet owners, they will know of these sorts of differences, which but differences really. I mean, the big one that I thought at the beginning when I first started looking into this would be euthanasia. And I thought that would be the biggest difference. And of course, it is a big difference, because obviously we don't take our 5-year-old and to clinic and say, can't take care of this 5-year-old anymore. I'm thinking of, so the issue with euthanasia, I think, is that they have to sort of, try and. Sometimes there's a big negotiation goes on, because sometimes a client will bring an animal in because they can't take care of it anymore.
I was going to say, is it more about housing, especially these days with with the difficulty of the cost of living? Unfortunately, it's flowed on, hasn't it, to people not being able to afford to keep their animals, keep their pets.
That's right. And following COVID, a lot of people, I know in the UK in particular, bought a dog, to sort of keep them company, and a COVID pet. Yeah, there's lots of COVID pets out there, and they generally weren't, sort of COVID fish or sort of things that don't need that much care. They were often, they were usually animals. They were of one kind or another. But yeah, so that is, that is something that is a big difference. Euthanasia, but I think. Probably the biggest difference was actually related to money and finance. And yes, it goes back to what you've just said about, about austerity, but not only. Yes, so Kerry's saying one of the major issues facing staff and veterinary practice, the costs of treatment.
The cost of treatment, yes. Yeah.
Exactly. So while I witnessed lots of negotiations, if you like, between the client and the vet, sort of fully understand what this was about until I went to this webinar that Jonathan McFarland organized the other day. I had seen in practice without understanding the theory behind it, or the methodology, whatever. And it's known as the spectrum of care.
Oh, okay.
Yeah, have you come across that at all?
No, I haven't. No, I haven't. Can you explain it for us?
Yeah.
Spectrum of care. Okay.
The spectrum of care. Yeah. So this is where I feel that the OET clinical communications criteria fall short when we're talking about vets. So the spectrum of care is essentially a sort of super enhanced decision-making process, if you like.
Okay.
And what it is that the pet is basically advocating for the vet and pet. The vet is advocating for the patient, for the patient.
Pet.
Yeah. And this is something that one of the vets told me during the observation. I said, what do you see as your key role? She says, well, advocate, because somebody's got to step in there, be the voice of reason, and with their evidence-based knowledge, say, okay, this is what we're looking at here. So they act as an advocate for the pet, and rightly so, because there's a lot of emotion involved with pets. So the spectrum of care is about offering the client a range of options. Okay, so from the basic treatment, or rather, they start with the advanced treatment, and then they offer a more basic treatment. And that will be sort of obviously measured price-wise. You've got that balance there. And as Kerry's saying, the cost of treatment is, if anybody has a pet, they know it can be, particularly in Europe, can be very, very costly. So we're looking at, the variety, if you like, of options, and presenting that variety of options to the client. And these are evidence-based, they're looking at the condition of the pet, and then they're sort of saying, well, these are the options, and let's go from there. So it's bearing in mind the possible financial limitations, if you like, of the client. And that's something that has to be, got to bear that. They have to bear that in mind continuously. It was, I think I observed like about 15 consultations. This is bearing in mind it's a small animal practice, right? So 15 consultations. So it was all about cats and dogs, more dogs than cats, but it was all about dogs and cats. So in those time, in virtually, I would say about 10 out of 15 of it, there was a financial issue of some sort. So
and going back, I mean, you mentioned before that one of the similarities is not being judgmental, and of course. It must be really hard for a vet to and for the client. I mean, you don't want to appear to be dismissive of the needs of the pet or uncaring.
That's right.
The bottom line is there's a certain amount that you can afford, and
that's right.
So it's what can you do up to this amount of money. Really?
Yeah, exactly. And I have seen there are scenarios on the OET website, and some of our listeners may have used them where they do include an element. The client doesn't want to bring up the money issue because they don't want to look heartless, etc. So that is included in OET, but I think it's a bigger aspect. But I'll give you an example maybe, because I think that's sort of will highlight to people what we're looking at. So Jerry was a rescue dog, I think, just another little Scotty dog like type cross, I think, and he'd had ongoing diarrhea and vomiting, not been eating for several days. So this couple brought him in, and I was told by the vet, there's a financial issue here before they came in. So obviously they were regulars, that they knew them. And but the vet sort of said, well, we're going to need some further investigation. So we've got some options to look at. And option one is, on one side, in order to carry out more investigations, etc., more testing, more examination, it's looking, we could, admit the pet into the hospital, the hospital for treatment,
overnight care.
Exactly. And so the question was, well, how much is that going to cost?
Yes.
And she's like, £1,000. So the reaction was, well, I've only got £70. I'm not getting paid till Friday. And you could tell from the way these people presented and etc. that they were living, they were not, they weren't sort of financially, they weren't affluent, let's put it that way. And so she's sort of saying, well, I completely understand. That's why I'm going to give you some different options. Let's look at the different options. And so there was, the other options were to sort of prioritize certain medication and then treat the pet at home. So prioritize, I think in this case, it was the anti-sickness and an appetite stimulant. But in order to, that the dog also needed to take the equivalent of paracetamol, essentially, and so that was going to be one of the more costly elements. But what they could do was to go next door to Boots the chemist and buy sugar-free Calpol, because it had to be in a liquid form in order to administer it more easily. And so, but the suggestion was, don't tell them in Boots that it's for an animal, otherwise they won't sell it to you. So don't go to the pharmacist and say, well, the vet's next door, they told me to come and get. So all that was going, or they could go online and buy a cheaper treatment. And so that was going to cost £80 all told, with the consultant fees included in that. And the head vet said, they've got to cover that, they've got to cover a certain amount. So and so they came to a compromise. The compromise was that this couple could pay £70 today and then come in on Friday with the additional £10. So that's an example. I didn't realize that this was the spectrum of care, but this is something, and this is an everyday occurrence, virtually every consultation. So that's why I would say
the client has to feel that all is not lost because they can't get the optimum care. So that they will still be able to do so. But it puts quite a lot of stress on the client, because
Absolutely.
they have to be able to administer. Sometimes it's tricky administering medication to a pet, and they've got and they've got to be able to do that. But I guess there's no choice, is there? You either do that or your pet's very ill. Yeah,
that's right. Yeah, that's right. So I think that was a good example of what there was kind of an extreme example, obviously, but this does happen.
Very likely an example that vets are seeing quite frequently these days,
and possibly
probably
more so.
isn't extreme. Yeah.
No, maybe not. Yeah.
So looking at the you mentioned the triad, the pet, the vet, the client. Who has the power in the consultation?
Well, I have to admit, if Jonathan Farland is watching this at a later date, I have to admit that I stole that question from his webinar the other day, because it is. It's so it's who has the power? But I think it is, because you've got that triad, and so when you're when you're training your veterinary students or your veterinary professionals, you always going to have to bear that in mind all the time. And so I thought, with this triad, so who has the power? Well, certainly not the animal has the power.
No,
so it's it's between. So you would think that the vet had the power. And I thought that was, this is something that they discussed in this webinar, who had the power, because obviously, as I said, again, they are advocating for the pet. They, have the knowledge, the evidence base, etc. So maybe that's it. But I tend to sort of think that ultimately it's going to be the owner, the client, that has the power, because they're the ones that are, at the end of the day, going to decide how much they can afford. So the vet is obviously going to do as much as they can to present all the information, but at the end of the day, it's I haven't looked into this in any great detail, but my sort of gut feeling, having done these observations, is that it ultimately is the client.
And it makes that, thinking back to an OET role play, if you were to reflect that, it's quite a complex one. There's an awful lot of talk about money and not so much talk about all the rest of it. But the consultations are must be longer than with a human, because it takes quite a long time to say, well, this is the best. This is the best, but on the other hand, you could have this, and all that negotiating takes time, doesn't it?
No, exactly. And I mean, some people, and I noticed, I saw this quite often, where some people are like, well, you're the vet, you tell me, but the client's perspective is vital. It's a part of the discussion process. Yeah. But then again,
very interesting.
Not wanting to be judgmental, etc. And it's a tough.
Definitely. So, what about? I mean, we talked about cats and dogs and maybe rabbits, but what about some unusual
small fluffy things?
Yeah, small fluffy. What about some unusual veterinary environments? That you've come across.
I have recently, So I had actually Bethan, I think it was Bethan that gave me the contact. So somebody who works trains vets, overseas vets for OET and IELTS, I think. And so this is Patrick Quigley. So I had a quick chat with him, and he tells me that the people that he's training are currently working in slaughterhouses. So they don't quite have the level yet, and they haven't, passed their OET or their IELTS, and so they were working in slaughterhouses. And so this is the less appealing, much less appealing life of a vet. So these guys are men, essentially. They are trained as small practice vets in their own country. A lot of them came from Turkey. There was also Spain and Cyprus, but you know, in the meantime, they're working as vets in slaughterhouses, and that is, there's apparently in the UK alone 121 abattoirs in the UK.
Yep.
And you know, and so a lot of what they're doing is actually making sure that the welfare of the livestock as it arrives, on arrival, and through the process they go through, again, you know,
Yes.
might not be pleasant for some people, and they have to check that, you know, everything is done according to European standards, and in the UK the Food Standards Association, the FSA, because obviously this is food that is going into the market, and so you know, there's very strict protocols in terms of how you stun the animal, and the vets are there to ensure that, and you know, and so I was sort of saying to him, well, you know, what about OET? You know, that he's like, they have very, very little communication with anybody. It seems they're working awful hours, like they're working from like 4 a.m. in the morning, and I mean, it's just, you know, it sounds horrendous. And so, you know, the only sort of communication that they have is sort of really in English, is sort of issuing verbal or written cautions to the slaughterhouse, and I don't know, maybe with farmers as well, I'm not sure, but somewhere along the chain, and you know, because that hasn't, you know, the welfare of the livestock hasn't met the standards. So in that sense, you know, they're doing OET obviously for their future, but you know, currently.
But then thinking also of, you know, vets don't only work with pets.
No.
You know, there's I mean, I know where I live, it's a rural area, and friends have got animals, livestock, and they offer, you know, the vet's always out there, and it's all about the welfare of the animal, and it's
and essentially, and
slaughterhouses definitely. I mean, of course, they need vets in there, so. But it certainly is less appealing. What about other less or unusual places?
So I had the chance last week a couple of days ago actually, to talk to Sarah Brown, who is a contact through a friend of mine, Evan Friendo, and she works amongst other things with the zoo in Berlin. So apparently there's two zoos in Berlin. So and she works in the Tiergarten, for anybody who knows that. So I said, well, you know, what do the vets do there? And she said, well, actually, there's only one for the Tiergarten. But she's just started working the other zoo as well. So apparently there's like a group of 4 of them. And I mean, maybe that mainly what they're doing is things like, you know, attending conferences and maybe writing papers as well. But they also get involved in like the welfare of the animal when it's in transportation. So, for example, she said one of the first tasks she had was to work with the vet and the zookeepers, the transportation of a new panda from China. So it was medical English as a lingua franca, if you like, which is a thing. And so they were sort of, in terms of the logistics, the transportation, the general welfare, quarantine, etc., of this panda. And then with the zookeepers, she worked on like how to deliver the sessions that for the people that come to the zoo, like the panda feeding session, for example. So she's helped them sort of you know, with their delivery and that sort of thing. So and working with sort of behind the scenes visits, VIP guests, that sort of thing. So so I mean, there's, you know, there's different aspects.
A bit of a dream job.
Oh, absolutely. Really nice. Really nice. So I mean, that's that, I think that's a nice sort of conclusion to what we've been talking about. But you know, most of the people doing OET, vets, would be working with small animals, animal practice. But it's a absolutely fascinating area, and I'm sure I've only just, you know, sort of touched the surface.
It's a very wide range. And then, you know, then you get you know, things like people working with venom, snake venom and bee venom and all the rest of it, because there's a lot of development of drugs from that now. So that's another. I mean, it's an incredibly large area.
Yeah,
isn't it?
No, I wasn't aware of that.
Veterinary medicine.
Yeah.
Well, I
mean,
think I was going to say, I think we may have reached the end of just a snapshot of what Ros does with veterinary medicine. So I guess we're ready for questions.
Thank you so much, Ros and Virginia. That was fascinating. That was really interesting. If anybody has any questions, I think probably the best place to put them today is into the chat box. So if you do have any questions you'd like to ask Ros, then please pop them into the chat box. I might start off with a question, Ros, if that's all right. My big question when you were talking was money, which you've talked about. The other thing I was wondering is quite a lot of medical communication. When the patient arrives, they will have Googled all of their symptoms and they'll have an idea of what it could be. Did you notice that in veterinary as well?
Yeah. Stop saying absolutely. Yes. Did get that as well. Very definitely. I mean, and people sort of, maybe they take their time to sort of bring the pet to, it's a little bit different from a 5-year-old where you may go immediately to A&E. You might take your time, you might read up, you might think, okay, well, maybe, is it serious? Is it not serious? Is it just a small bite or something? Is it something more serious? So, people are doing that. Dr. Google plays, as big a role in veterinary medicine as it does in human medicine, I think. Possibly bigger.
I can imagine. But as a follow-up, did you notice anything along the lines of very unreliable information? Because if you're a patient and you can look for information, you go to the NHS or you can go to these kind of places where you think you could find reliable information. I'm talking from personal experience, as Virginia, my son now has a hamster, and I've tried to look for information, and I come across stuff, and it just doesn't look like I don't necessarily think, oh, well, this is an evidence-based piece of information. Was that anything that you noticed?
Not necessarily, but I did notice, the sort of exactly as you would in human medicine, saying, okay, that, great, pleased that you found that information. That's good to know. Just so that we're both on the same page. And then the vet launches into what they understand it to be, etc. So I mean, I think it's easier maybe for in human medicine to find reliable websites, because we know we sort of know what we're looking for in terms of a reliable website. To go on the NHS or the American or Australian equivalent. Do you know what I mean? So it's
All right, so you've got a question in the chat box. I think it's from
I have,
Jan.
and that's interesting. Okay, so did you pick up other funding charities as well as the PDSA? Did you pick up on right? So yes, I think that there are. So just for people that are outside of the UK, the PDSA is a sort of a charity that helps people fund the care of their treatment, the care of treatment for their pets. But there, and I did ask about this, there's also the Dog Trust as well. I'm not sure if there's a cat equivalent, but there might be. As you can see, I'm more sort of a dog person than a cat person. Anyway, but mainly because, most of the consultations also were about dogs. But anyway, so interestingly, I did ask about that. In the case of Jerry that I cited at the beginning, where the people, they had a problem paying the £1,000 compared to the £80. So I said to the vet afterwards, I said, what about the PDSA? Could they have gone to the PDSA? And she said, well, the PDSA will only fund up to a certain limit. And I think it was something like, was it £500? I can't remember. It could even have been 50. I can't remember. I have to look back at my notes.
It was something very low, wasn't it? Yeah.
Something quite low. But also what they do is that they will consider the prognosis. If it's likely that the pet won't pull through, they won't fund it. So yes, these charities exist. And I'm guessing I'm sure they exist in Australia. possibly in other countries in Europe as well. But there are limits as to what they are prepared to do, apparently. So it's kind of, the 17-year-old blind and deaf Scotty dog that I mentioned at the beginning, bless little thing, it was so cute. Probably not. So yeah.
And actually, I remember that in Australia, you couldn't get pet insurance after the pet was something like 7 years old, whereas in the UK, it seems to be possible to get pet insurance, whatever the age of the animal.
That's a possibility. I hadn't sort of checked up on that, but yeah. I mean, most of the clients coming through had some kind of insurance, even if it only covered like very basic things. But it won't, it won't pay for everything.
Doesn't stretch very far. No,
doesn't stretch very far. Exactly. Yeah. So it's a tough one. It's a tough one, and I think I think the vets also find that tough to deal with as well, because obviously they want the best for the pet, and as I said, they are the advocate of the pet, so they that's part of their key part of their role. Kerry, often clients Google before their visit and find a Facebook forum. Yeah, I'm sure they do. Yeah. I think it's the same as with human medicine. People want to feel supported, so there are these forums that exist, I guess, that people, my dog's got this, my cat's got this, I'm going through, it's been suggested that, the dog's come, to the end of its life. So, has anybody gone through that process of euthanasia? And, and that in particular is, and I think that's something that's done very well. I know that when my mum's, beloved Bella passed away last year, the veterinary practice where she goes was really they had a candle for the pet, so every time you go into the vet, it's a small practice, and there is and if you went to the door, that there is somebody in the surgery at the time, in the clinic at the time, who is is grieving because of their pet. So there's a candle and all of that. So as you enter, as you're sitting in the waiting room, so it's.
I think they are quite. They're very well trained. Yeah, they're well trained in that area.
I think in that particular aspect, I think they're really well trained. And I know one of the vets that I was following, she'd only just qualified, and she was in tears one day. I saw her sort of rush off at some point. She found that aspect very difficult. Yeah.
I've got a question. I think we need more vets, don't we?
There's a shortage in Europe, apparently. Yeah,
there's a real shortage. Do you see more English for vet classes? The English for vet classes around, or is there more interest in English for vets now?
I've been told there is. Yes. And hence, I was put in touch with Patrick Quigley, who's training these vets coming through from Turkey. Interestingly, the guy with the deaf-blind Scotty dog, he says that his wife's carer is Turkish, and he's actually a vet. So he's working not in a slaughterhouse. I think I'd rather have been the wife's carer.
Well, yes,
and he's working as a carer. Presumably, right. I didn't ask him too many questions, but presumably so that he, while he's in the process of preparing his, OET and other qualifications. So, that's no, I think there's a need. There's a need
for it. Yeah.
Mm-hmm. So Gian's saying, the rcvs.org.uk. Yes, very definitely. That is a good resource. I can send you, Bethan, if you want, a couple of resources. Essentially, I mean, these are books that they actually look very familiar to. I don't know that will be read. That will be mirrored, I guess. But Skills for Communications in Veterinary Medicine by Susan Kurtz, who worked with Jonathan Silverman, who devised the Calgary-Cambridge Guide. which forms part of OET speaking criteria, clinical communications criteria. So, you know, there's a strong link, and you know, it is when you look through these books. I've got another one as well from similar, and you know, they're very, very familiar to us in human medicine, healthcare.
Interesting. Great. All right. I think we'll wrap up. So thank you so much for joining us and talking to us about your research and your experiences and what you've been finding out. That's really interesting. And thank you, Virginia, for joining us from all the way on the other side of the world, from me at least. We really appreciate it.
No problem.
And great. Thank you so much. And we look forward to seeing everyone at our next Healthy webinar, which will be towards the end of June. So you can find out more details about that on the Healthy website. And
Excellent.
Thank you very much. Have a nice evening. Have a nice day. And we'll see you all soon. Bye-bye.
Thank you,
Thanks,
everybody.
Megan. Goodbye, everyone.
Thanks. Bye-bye.